Good afternoon, everyone, and thank you so much for joining us today for Shatterproof's Continuous Quality Improvement Learning Series. We are very grateful to have you all here. This is being recorded today. My name is Dr. Lisa Kugler. I'm the Senior Vice President of Treatment Atlas and appreciate everyone's support over the holidays and over the past year, especially as we continue to grow and expand and increase the number of providers on Treatment Atlas. We love to give back and to provide some learning series that addresses a hot topic of the day. Just wanted to let this team know that we have a new sort of process. If you or anyone that you know has used Treatment Atlas and you would like to submit a testimonial on how that experience was, please feel free to use this link. We will be sending the slide deck out after the presentation, and you are able to submit any kind of testimonial, feedback, etc. We are always interested in how people are experiencing Treatment Atlas and utilizing Treatment Atlas. In addition, for the treatment facility surveys are fresh for 2 years. So if you did complete your treatment facility survey in 2022, please make certain that you have updated it. The updating process only takes about 15 minutes, and then it will be up on the website for the next 2 years. We are reaching about 1 million individuals per year. So we really want individuals to be able to see your facility and everything that you offer in your facility. So please make certain to quickly update, validate the information. As I mentioned, it's only about a 15-minute process. So all of the general public is able to see what great services each of you offers. Now it is my pleasure to present to you Dr. Mark Fuller, who is the Medical Director of Carelon Health in Pennsylvania. He is board certified in 4 specialties, including psychiatry, internal medicine, addiction medicine, and addiction psychiatry. He has extensive experience in behavioral health and substance use, previously worked as a provider at Allegheny Health Network, and has had administrative experiences working as a senior physician for several national managed care organizations. He also is published and has a strong interest in teaching and research. He's going to be talking today about one of the emerging trends that we're seeing out here in the East, which is Xylazine, which is bringing up a number of challenges, and some of them are a bit unique to our field. So thank you so much, Dr. Fuller, for joining us today, and I will now be turning it over to him.
Thank you, Dr. Kugler. I appreciate that. Let me share my screen here and make sure that we get the right PowerPoint up. How am I doing, Dr. Kugler?
You're good.
On. All right. And since everyone's muted for the presentation, if they do have questions that come up, we'll leave 10 minutes at the end for question to answer. But if something comes up during it, would you prefer they put it in the chat or in the Q&A link?
They're able to put it in the chat, and I'll be watching the chat so I can let you know if any questions come in. And Dr. Fuller, do you want then all questions held till the end?
Yeah, why don't we do that? Unless there's something that seems really pertinent to the slide I'm speaking to. If someone needs clarification on, please feel free to jump in and let me know. Okay? All right. Well, hi, everybody. It's a pleasure to be here, especially as the holidays approach. Thanks for taking time out to talk about a very important subject. It is a new contaminant in the drug supply called Xylazine, and is considered a pretty significant threat to our community. Dr. Kugler was already kind enough to, let me take that off of there. There we go. Sorry, just getting my slides advanced here. There we go. And we already discussed the introductions. I'm currently the medical director for a managed care behavioral health MCO in Pennsylvania. So here's a comment from our DEA administrator, Ann Milgram, about Xylazine. Says Xylazine is making the deadliest drug threat our country has ever faced, even deadlier than fentanyl, which should give you a sense of how serious this is. And we'll talk a little bit about how it got here and what some of the implications are. So a couple of fast facts. Xylazine is also known as Tranq. That's its brand name. And I realize Xylazine can be a little difficult to pronounce. So if you just want to say Tranq during the presentation of a question, I'll know exactly what you're talking about. It's a non-opioid sedative analgesic. Now, what does that mean? It means it doesn't do the same thing as heroin or fentanyl or Percocet or any of those medications. So it's not an opioid, but it is a sedative, and analgesic means removes pain. So the sedative property is one of the things that can make you feel sleepy, drowsy. Some people experience it as a feeling of euphoria, but it's not an opioid. So that's a very important thing to notice. It's available in powder or liquid forms. It is often sold in vials or pre-filled syringes. You can see, here's a picture of this. This is a prescription medication. This is a real medication, but it's not for humans. Xylazine and fentanyl mixtures have been found in 48 to 50 states. We suspect we'll see it in all 50 states in the not too distant future. In 2022, about a quarter of all fentanyl powder seized was contaminated with xylazine, about 7% of all fentanyl pills. I'll mention this later. Some folks that use drugs feel that it's safer to use pills because they feel like they're buying something that was pre-made and that there'll be less contaminant. That may have been true in the past. It's not approved today. Drug dealers buy their own pill presses that come directly from China, and they can make pills that look exactly like the prescription medication or the one that comes from your pharmacist, but they put contaminants in it like xylazine and fentanyl. It is legitimately sold by pharmaceutical companies and websites that cater to veterinarians. It's not for human use. This was originally developed, tested in humans. It was found to be too dangerous to be used in humans and was moved to veterinarian use. Some people report becoming physically dependent on and experience withdrawal seizures when stopped. Some of those symptoms can be chest pain and seizures. Couple recent developments. It is rapidly increasing in the U.S. illegal drug supply, with the largest increase in the South. It's been found mixed with fentanyl, heroin, and cocaine. I mentioned it been seized in 48 to 50 states, and the White House has declared it an emerging threat. Now, not all states test for or report xylazine-related deaths, so the actual contribution to the overdose death is currently unknown. It is not currently classified as a controlled substance. However, efforts are underway to change this, and at the end, under a section called Breaking News, I'll go into some of the very recent developments as people and communities have tried to respond to this threat. In July 2023, the White House released a national response plan to the growing threat caused by xylazine. And there'll be a link in the references directly to this. Most of the things that I'm going to talk about will be in the references, and many of them will have a link directly to that website. So where did it come from? It was first synthesized by Bayer Pharmaceutical Corporation in 1962 as a medication for use in humans. It was found to be totally unsuitable due to sedation and to very low blood pressure. It was then tried for veterinarian use and was finally approved for animals in 1971, where it's actually fairly effective, but not for humans. It is not a controlled substance. That is, you don't need a DEA license to prescribe it. It was first seen in Puerto Rico in the early 2000s, and this was found through DEA and laboratory analysis, and then kind of went away until the early 2010s, when it was found in the continental U.S. for the first time, primarily in the Northeast U.S., and actually in the Philadelphia, Delaware area. It turned out to be one of the epicenters of this emerging threat. The Sinaloa cartel and the Jalisco cartels in Mexico are two of the largest suppliers of fentanyl being trafficked in the U.S. They primarily use chemicals sourced from China, and this is in the news. You'll read this is a topic of discussion between the U.S. and China. However, it appears that xylazine is introduced into the drug supply after it enters the U.S. So what's coming across the border is primarily fentanyl, heroin, other drugs. The xylazine doesn't get introduced, so it gets into the U.S. when drug dealers add it. We'll talk about why that would be. Why would you add xylazine to the fentanyl? Now, from this very small beginning, how did this get to be a hit so fast? And the answer, the hint is it's all about Benjamins. It's used as a cutting agent to benefit drug dealers in sales. That is, if you start with a kilo of fentanyl and you add a kilo of xylazine, you suddenly have 2 kilos of fentanyl that you can sell. It increases the size and the weight, thus increasing the amount of drug that can be sold. And xylazine is available for $6 to $20 a kilogram, no prescription needed. The chemicals used to produce fentanyl can cost $75 or more a kilogram. So obviously adding xylazine to fentanyl, inexpensive substance in an expensive substance, creates even more of that expensive substance. Many people use it because they believe or experience it as prolonging the euphoria associated with opioids. Fentanyl and heroin have pretty short half-lives. The euphoria doesn't last a long time. And the addition of xylazine to it gives the user the feeling that the high is lasting much longer. Therefore, they feel like they're getting more for their money. As mentioned earlier, it was first detected in Philadelphia. So obviously a map of Pennsylvania, Philadelphia, they are in the southeast corner of Pennsylvania. Overdose deaths were almost non-existent in the early part of the 2000s. And in fact, as recently as 2015, only 15 xylazine deaths were reported in the Philadelphia area. In 2021, there were 434, and I was looking at a report this morning. I didn't see the exact number, but it's skyrocketed since then. It's currently estimated that 90% of street opioids in Philadelphia contain xylazine, which now is clearly the epicenter of this epidemic, which means that pretty much anyone using heroin or other opioids in the greater Philadelphia area has probably been exposed to xylazine or will be exposed to xylazine. And as it moves out into other areas, again, it's usually not mentioned when the drug is sold. This is pure heroin, which it's not. It's pure fentanyl contaminated with xylazine. Across Pennsylvania, overdose deaths involving xylazine have increased significantly. Again, about 2% in 2015, and in a study in 2020, it looked all across Pennsylvania, not just Philly. It was about a quarter of all deaths, significantly increased now. It was originally sold separately as an add-on to increase and prolong the effects of opioids. That's no longer the case. It's just added in and sold as fentanyl. So, as I mentioned, most people are unaware that they're taking xylazine. In looking at some of the things that are happening in Pennsylvania, that's where I live, so the reason I mentioned it, but we're also going to speak to national standards and events, and that's also because Philadelphia's been one of the epicenters. So in 2023, Pennsylvania declared xylazine a controlled substance. So very recently it became a Schedule 3 to make it harder to get and access. It is the most common adulterant in street opioids, and almost everyone in eastern Pennsylvania who's using illicit opioids has been exposed to xylazine. It's been slower to spread to western Pennsylvania and other states, but it is becoming a more and more common adulterant, and it will, in all likelihood, become part of the illicit opioid trade throughout the eastern U.S. at this moment. Pennsylvania legislature passed a bill which criminalizes the misuse of xylazine just a few weeks ago, and Governor Shapiro has reported he will sign it, and it also formalizes xylazine as a Schedule 3 drug in Pennsylvania. What about the rest of the country? So we've talked a little bit about Pennsylvania. Let's look at what's happening elsewhere. So this gives us the prevalence of xylazine reach across the U.S. It's color-coded by drug overdose deaths associated with xylazine. The darker the color, the higher the rate of overdose deaths associated with xylazine. So as you can see on this map, Region 3 has the highest. That's Philly, that's Maryland, that's Virginia, that's Delaware, Pennsylvania. That has a fairly high rate of overdose. The dark blue, that includes the Southeast United States, the Northeast United States, and the Great Lakes, the kind of upper Midwest, has a still significant, but a smaller overdose death rate associated with xylazine. The Midwest and Texas is green, even less. And then the West region, very little xylazine involved. It's interesting, I think, how these drug traffic patterns happen. But the West generally has more stimulants, such as crystal meth and other methamphetamines, whereas the East Coast tends to have a little more opioids. So what about overdoses? If xylazine is involved, obviously when people come upon an overdose, unless you know the person, know what they were doing, it's impossible to know what drugs they've ingested. So one of the questions is if it's a xylazine overdose or if xylazine involved, should Narcan be given? And the answer is a resounding yes. Narcan should absolutely be given, especially in an unknown drug overdose. It does not reverse the effects of xylazine. That's important to know. It will reverse the effects of fentanyl, heroin, and other opioids that have been mixed in, and that's why you give it, because those drugs are also potentially lethal drugs. All the opioids put the respiratory center to sleep. The individual stops breathing and dies. That's the one of the main causes of death, or the main cause of death is respiratory depression. Xylazine makes that worse, but xylazine is not reversed by Narcan. It's also essential to call 911 as additional medical care, transport, and life support may be required. Rescue breaths, mouth to mouth, should be given if you're qualified, as xylazine can cause respiratory depression. And then just to note, Good Samaritan laws in Pennsylvania and many other states protect anyone assisting with an emergency overdose from arrest or charges. And Dr. Kugler, I saw a question about this slide pop up.
Yes. I can read it to you. If I have a patient who reports cocaine abuse and reports no opioids or tests negative for opioids, but is acting as though on opioids, should I suspect xylazine?
Actually, I would first suspect fentanyl in the cocaine, and then I would expect xylazine. So there have been many cases of fentanyl contaminated cocaine. In fact, it was one of the reasons many of you have read about the unfortunate death of the Friends actor Matthew Perry by a ketamine overdose. Why was he taking ketamine? And some preliminary reports have suggested that there were a couple of fentanyl contaminated cocaine deaths in Hollywood in a very short order, and that many celebrities switched from cocaine to ketamine to avoid xylazine. That's not necessarily the case. There have been ketamine contaminated with fentanyl as well. But for this individual, I would try things like a urine drug screen or xylazine test strips, so the person could test the drug before they used it. But I would strongly suspect that cocaine is contaminated with either fentanyl or xylazine or both. So thanks, good question. A couple of other things to know about xylazine. When combined with opioids, it increases the risk of fatal overdose. It lasts much longer than many opioids, and it's up for 8 hours. It generally doesn't show up in routine drug tests, but some new tests are starting to include it, and test strips have recently become available. So most urine drug screens that have been around for years, we're looking for the usual things. Looking for opioids, we're looking for benzos, you're looking for cocaine and other stimulants. I mean, there's a variety of things you're looking for. We weren't looking for xylazine back when many of those tests were developed. Now, some of the newer dipsticks and test cups are starting to include xylazine, and there are some test strips which are available for testing drugs before use that can also tell you whether they're contaminated with xylazine. Xylazine can be used by injection, nasal insufflation, swallowing, or inhaling. Emerging medical personnel should be alert to the possibility of xylazine whenever treating an opioid overdose, especially given the part of the country you're in. If you're in the East Coast, especially in the Mid-Atlantic region, you should absolutely assume xylazine is part of this complex overdose. Here's a couple of effects that xylazine will have on the body. CNS effects on the central nervous system. It'll help block pain. It does cause sedation and sleepiness or coma, and it can also cause amnesia. On the respiratory system, it does cause respiratory depression and can cause people to stop breathing. As far as the skin, it can cause ulcers and tissue necrosis. We'll talk about that in a little bit. This is one of the more dramatic features of it, these gigantic skin ulcers and wounds that can result from xylazine use. On the cardiovascular system, it can cause low blood pressure. It generally causes low heart rate, but can cause high heart rate as the body tries to adjust to the low blood pressure. And then it can do a thing called vasoconstriction. That is, it can squeeze down blood vessels. And we'll talk about this when we get to the wounds, but it may be this property, the squeezing down the small blood vessels, that is the reason for these skin wounds that are so grievous. And then it can also cause on the metabolic endocrine system, it can cause high blood sugars. As I mentioned earlier, there's no known reversal agent for xylazine. Narcan does not treat it. It will treat the opioid. Xylazine is rarely, if ever, taken by itself. It's usually taken in conjunction with other drugs, most commonly opioids, but has been seen in cocaine. And there have been at least one or two notes that it was been seen in ketamine as well. But opioids are primarily where you see it. This heightened risk for overdose can be increased with other CNS depressants. So if someone's taking alcohol or benzodiazepines with the xylazine contaminated fentanyl, that can make the overdose go up even further. And again, mentioned Narcan is used, and it will help with the opioids, but just not the xylazine. However, there are other things that can be done. So the main thing that happens to folks again when they're overdosing on a combination of opioid and xylazine is this sedation, the suppression of the respiratory system, and that can be addressed with ventilation. So giving Narcan in the field and calling 911 to get an ambulance there are critical factors in reversing whatever part of the opioid overdose you can reverse, but then providing life-saving oxygen and breathing for the artificial breathing for the individual. And because the xylazine can last so long, some of these folks, if you get them in the hospital and breathe for them until the xylazine wears off, you can keep them alive. And sometimes need support for their cardiovascular system to keep their blood pressure up and their heart rate up. And those are other things that can be done in a intensive care setting. So transfer to a hospital setting can be critical and life-saving for folks that have the combined overdose. So one more comment. So many of you have heard or maybe seen folks that have pure opioid overdose who have the reversal in the field with Narcan and then get up and refuse hospitalization and go on about their day. That will not happen with xylazine. They'll not regain consciousness generally. They will, you can't reverse the opioid part, but the xylazine part will not be reversed, and they will need additional ventilation.
Dr. Fuller, another question's come through. How long does it take for the xylazine to go through the body?
About 8 hours. If you get a massive dose that overwhelms the body's ability to get rid of it, it could take a little longer, but 8 hours is a pretty good number. Thanks. So we're going to talk about these awful skin ulcers for a minute. This has been one of the most dramatic and confusing aspects of xylazine use, is people develop these big ulcers on their arms and legs and other parts of their body. Now, for folks who are injecting drugs, they're used to having infections. It happens. It's part of using injectable drugs. However, those infections usually happen at the injection site, so often on the arms, back hands, places where people normally inject. And they actually are an infectious event. There's bacteria in there causing the infection. These do not occur at the injection site. They can, but they often occur away from the injection site. And they're not typically infected. This is a different kind of wound. So a couple of things, and so this is confusing to the individual using drugs because again, being aware and understanding infections occur at injection sites. If a person gets a wound there, they'll generally stop injecting there and either seek medical attention or treat themselves. These wounds are showing up on other places where they're not injecting. So most folks do not equate the ulcer and the wound with their substance use and often delay getting treatment because they're not sure what it is. So these are not skin infections. It's thought these are due to the constriction of the blood supply that xylazine does. And so with the lack of blood to these areas, the skin dies, and so does the underlying tissue. There is good treatment. Treatment consists of stopping the drug use so you don't have any more xylazine in the system. Good wound care, good wound care, including a variety of other things, debridement, long-term dressings, access to clean water and sterile supplies, along with good hygiene, safe housing, adequate nutrition. So in some cases, the wound may develop a secondary infection and cause antibiotics, but these are not primarily infectious wounds, and just taking antibiotics will not make them go away. Now, I do have a kind of a trigger warning here. The next slide is going to be kind of graphic. I am going to show you just a couple pictures of the wounds. For those of you that are comfortable with that, please watch. For those who aren't, you might want to turn your camera off for a second, just turn your head to the side. I'll tell you when this is over. I'm just going to talk about these wounds for a minute. But they're fairly dramatic, and it's important to recognize them, those of you that are caregivers or first responders. So when you see these wounds, you understand what's going on. All right, I'm going to go to the next slide now. So these are an example of a couple of wounds that have gone on quite a bit. These are not early stage wounds. These are people who got wounds, didn't know what they are, neglected them, and people that are using drugs are not, normally interacting with the healthcare system, and so they don't normally get these things looked at. Just to orient you, the long picture on the left, that's a leg, and down to the left-hand side is the ankle, the knees to the right. And so this is a person who never injected in their leg and began to develop this awful wound and just did not know what it was. On the kind of upper right-hand corner, you can see the back of a hand has lost a lot of the skin and underlying tissue. And the lower right-hand corner, you can see the wounds over the back of the arms. Again, folks that have this serious wound generally require hospitalization. It's critical to stop the substance use so you don't have any further constriction of those blood vessels so you can get good blood supply. These folks are going to need wound specialists. Some can be treated on an outpatient basis. Some will need inpatient care. These wounds can heal up, and I've treated people with these wounds. I've seen them get better, but they do need to stop using drugs. They do need to get under medical care, and good nutrition, hydration are very, very important to healing up these wounds. Okay, I'm going to move on. For those of you that have turned away from the slide presentation, you can turn back. I'm back to using text now.
Dr. Fuller, another one came in. Are you saying that the wounds can occur at sites that are not used for the injection?
In fact, they most often do. Yeah, they occur in other parts of the body. So those wounds on the back of the arm, not many people inject on the back of the arm. If you run out of every other space, you might. Back of the hands, people can inject there, but very few people inject in the leg. If they do, it's usually down around the toes, places where it's easier to find blood vessels. So again, these wounds are not coming from the actual needle going in and pushing germs under the skin, which is how you usually get infections, or the drug itself is contaminated. These are coming from the xylazine flowing through the system, constricting the blood vessels in those areas, and then having that tissue die.
Another interesting question came through the chat. Also, I read we should not use peroxide or alcohol in these wounds. Can you comment?
Yeah. So I'm not a wound specialist, but those are not common treatments for it, because again, you're not trying to clean the wound. There can be certain wounds that have dead material in them or have bacteria, which would be cleaned in a different way by a wound specialist. But these wounds are not really to be cleaned on the street. That's not going to help them because they're not dirty wounds per se. So yeah, I would avoid those substances. Those are also caustic a little bit, and they can burn and kill what viable skin is there. So yeah, I would not use those on them. Okay, so I'm painting kind of a bleak story here. We have this drug contaminant in the system. It's hard to detect. Most people are unaware they're using it. So what are the positives? What can be done? So the first is exactly the kind of thing we're doing here today, and really hats off to Shatterproof and Dr. Kugler, you and your team for allowing us to have this discussion. People need to know about this. This for a long time was very much underground. It was confusing. What's where? We don't test for this, but there needs to be a high level of community awareness for both individuals who use drugs. So if they're starting to experience these symptoms, they can seek attention and get it addressed, but also for community health workers, first responders, doctors and nurses, people working in emergency departments, primary care. So when they see these signs and symptoms, they can include this in their differential diagnosis and address it. It's important to support educational efforts. People who use drugs need to know about this as an emerging threat, and also the lack of a reversal agent. So giving Narcan is good, but even if it doesn't fully reverse it, it is still good reversing at least the opioid part of that. And then recognizing that medical attention is necessary to support adequate ventilation. Harm reduction techniques are also very important. Test your drugs before you use. If you have access to strips, don't use alone as always, and have Narcan nearby in case there is an overdose. It's also recommended that community-based Narcan distribution be widely available along with overdose education. And then expanding access to medications for opioid use disorder, along with reducing barriers to access other levels of care and treatment. So the sooner that people can get into care and the sooner that evidence-based treatments like medications for opioid use disorders, or the more, not so much the sooner, but the more available they are, the more likely the community is to connect that person using the need of the services so that those additional adverse events, overdoses, wounds, other things can be stopped. Let me talk about a couple of things that are being done around the country. This is a pamphlet that's distributed in Rhode Island and can be adapted for distribution in your community. It's just a very short card, says how to stay safer with Xylazine, and just mentions what it is, veterinarian sedative, excuse me. Have Narcan, don't use alone, call 911, supportive breathing, treat your wounds, use new supply. So very short and sweet, but a nice way, kind of leave behind or handout at community educational events or healthcare fairs. And certainly anyone can adapt this. And I thought it was just a nice way to sort of short and sweet have a informational brochure, actually just a single card that you can give folks and help increase awareness, understanding of this threat. White House Office of National Drug Control Policy released this plan for addressing the growing presence of xylazine in drugs. This plan had 6 pillars. You can see more of it at whitehouse.gov, not whitehouse.com, but whitehouse.gov. This goes in depth around some of the issues. And the 6 pillars are: 1 is support testing for xylazine, get more urine drug screens to include it, and increase the availability of test strips so that individuals can test their drugs before using them so they will know in advance whether there's xylazine in there. We need a lot more research on xylazine. Could we develop a reversal agent? Is there something that could go along with Narcan? Are there other interventions that could be helpful in treating it? Detox is a little bit complicated because people using xylazine are using opioids. And so addressing the opioid detox along with the xylazine detox is still a complex issue that's not fully understood. Data collection, again, because most people and most institutions don't test for xylazine or collect data on it, we don't really know what's happening in a lot of environments, whether there is xylazine in the local drug supply or not. Further efforts to disrupt the xylazine supply. So xylazine's not coming from Mexico. It's not coming from China. It's here. And finding ways to prevent xylazine from entering the opioid drug supply system is really critical. And that's one of the things that places are working on. And one of those examples is increasing the difficulty in getting this. Right now, it's really too easily acquired, and making a scheduled substance, so you have to have a DEA license to get it, is a good strategy there. And then developing more evidence-based practices for how to address people who are using xylazine, and then using existing harm reduction strategies in terms of education, in terms of clean needles, in terms of educating people about the risk of using alone, having more Narcan available, all the things that we currently do in the harm reduction field. All right, just a couple of new things that are happening around the country. So this is one of the questions that came up earlier. There's been research showing that it's increasingly found in cocaine. Pills containing opioids like Percocet, once thought to be safe, clearly are contaminated. Not all of them, but many of them. And again, illegal. So pill presses are what pharmaceutical companies used to make pills. And they could only be bought and operated under a special license in the United States, and only pharmaceutical companies have those licenses. Increasingly, drug dealers are buying these pill presses illegally and making their own pills to look like Percocet, to look like Dilaudid, to look like OxyContin. And even though they look like that and people have a sense of a little more safety buying those, they're absolutely not safe. The counterfeit pills look exactly like the real ones. Most of them have fentanyl in them, and some of them also have xylazine. The Food and Drug Administration is taking action to restrict the unlawful entry of xylazine into the U.S. to address the growing health concern, and also restrict its availability within the U.S. West Virginia, which has led the nation in overdose deaths for several years, also has a xylazine problem, and they made xylazine a controlled substance just last year. Ohio Governor Mike DeWine issued an executive order to the State Board of Pharmacy to declare xylazine a controlled substance. Florida made xylazine a controlled substances in 2023. And so what is our federal government doing? They introduced House Resolution 1839 last year. It criminalizes the use of xylazine, establishes criminal penalties for manufacturing, distributing, dispensing, or possessing with intent to distribute xylazine for illicit use. It also made xylazine will also, when it's passed, I don't think it's passed yet, it will make xylazine a controlled substance at the Schedule 3 level, which is consistent with what the states are doing. So actually a little bit more bad news. Some of you have heard that xylazine in some areas is being replaced by another drug, medetomidine. This is really unfortunate. It was bad enough we had xylazine, and now medetomidine is showing up increasingly as a new adulterant in fentanyl. So why is there a second agent? Well, xylazine is getting a little harder to get, so people are looking for another agent, and medetomidine, which is more potent than xylazine, is also not approved for humans. It's a veterinarian drug, so it is available. It is manufactured in the United States, and it is available to veterinarians and people that impersonate veterinarians. But it's not for humans, only for animals. It was first detected in the Philadelphia drug supply system in April of this year. Since then, it's been found in Maryland, Ohio, Florida, and Canada. And some fentanyl samples contain both xylazine and medetomidine, so kind of double trouble there. The symptoms and side effects seem similar to xylazine. Medetomidine is actually very similar chemically in terms of its effects to xylazine. Now, at this point, it's kind of early, so it's not clear if it'll produce the same wounds. There's a high likelihood, as they both have the same vasoconstrictive effects, And there's obviously more to come on this. There's a really nice report on this from the Philadelphia Department of Public Health, Division of Substance Use Prevention, Harm Reduction. In the uh, references, which you see, but there's a direct link to that report. It's a great summary. The Philadelphia Department of Public Health does a fabulous job as a public health organization. I strongly recommend them if you're looking for a source of late breaking news.
Dr. Fuller,
Yeah,
another question's come in.
thank you.
We test for xylazine and are seeing an increase in either Louisiana or Los Angeles, not sure which one. Is there somewhere we can report this? And is there any opportunity for financial support? Also, if we have cocaine abuser that tests positive for xylazine, should we detox them as though they are on opioids, i.e. methadone, Subutex, Suboxone, etc.?
Oh,
And
wonderful
are there
questions.
any tests available for metadata? I
No,
can't
don't
pronounce
worry,
it.
Doctor. No one can pronounce it. Metamidine. So, first question first. Report it to the Center for Disease Control. That's our main tracking, and the Drug Awareness Warning Network, DAWN, which is division of the CDC. All those are available at cdc.gov, and that is a great place to report it. The second one is if it shows up in cocaine, should they detox them for opioids? Is that the question?
Yes.
The question is, or the answer is only if they're also testing positive for opioids. So there's not currently any medically approved drugs for cocaine detoxification. People feel bad, but outside of supportive care and other things, there's not a lot that we can do medically for stimulant withdrawal. If there is, if there are opioids in the cocaine, so if they're finding fentanyl, yeah, absolutely detox for opioids. If there's not opioids, if there's just xylazine in the cocaine, then you would want to monitor for sedative withdrawal, much like someone coming off benzodiazepines or alcohol. So that would be the detox regimen you'd use. And then again, that's xylazine and cocaine alone, detox for status. I would watch first, though, and see what symptoms, because the amount of xylazine in drugs varies immensely. So this person may test positive, but they may have been using drugs that are contaminated at a very low level, and they don't have any withdrawal symptoms at all. That's another great question. And there was a third good question there.
Are there any test strips available for,
Metamidine. To
yeah,
my knowledge, there's not. I haven't seen any. Now, we didn't have any for fentanyl for the longest time. We didn't have any for xylazine. So I think probably what most people are doing is going to take a wait and see how rapidly does, if at all, does metamidine get into the drug supply. And if it gets in and it gets pretty bad, then I would expect us to see a test strips for that. But to my knowledge, there's no test strips for that at this time. Excellent questions. All right, and then recommendations. What can communities do about this crisis? First is public education. Exactly what we're doing here. Make sure people know. Put posters up. Sponsor community forums like this. It's critical that communities inform the public about the dangers, because most people don't know what it is. What's tranq? What does it do? How does it work? Why do I have wounds not at my injection site but in other places? And can those wounds be treated? That raise awareness of the changing illegal drug marketplace and the increasing contamination of opioids and drugs with xylazine. It feels like when that long ago we were informing people about the contamination of heroin with fentanyl, but that has progressed to the point where like everyone's aware of that, but xylazine not so much. So that's an important public health education message. Providing messages to community groups, especially those providing the services to people at risk. So this would include community leaders, school officials, faith-based outreach workers, parents, students, and other healthcare workers. When you see these strange wounds, or you have these people that are overdosing and are not responding to multiple Narcan's administration, think xylazine as a contaminant and a part of that. Providing test strips for people who use drugs to test for xylazine and fentanyl where it's legal. There are some parts of the United States where it's not legal. In fact, fentanyl test strips were not legal in Pennsylvania outside of two counties, Allegheny County, where Pittsburgh's located, and Philadelphia County, for many years. You could be arrested for distributing fentanyl test strips. It's now legal in, I believe, every county in the state. And then lastly, of course, link people at risk for overdose with care and inform them about the risk associated with xylazine wounds. And people that want to go to treatment, that want help, whether it's outpatient, inpatient, residential, help them get started on that journey. So in summary, people using street opioids in some areas, that would include Pennsylvania and most of the mid-Atlantic, are almost certainly exposed to some level of xylazine. And if this drug trend continues, probably most of the Southeast United States and Northeast United States, and then the Great Lakes states in the next year or so are likely to have that. It's unclear how far west this may go, but from at least one of our listeners, it's already in Los Angeles. So it's likely to be spreading pretty fast. Co-occurring xylazine and opiate withdrawal can be managed. It's a question of obviously treating the opioid symptoms, but also looking for sedative withdrawal symptoms from the xylazine. Xylazine increases the risk of fatal overdoses, and it's not responsive to Narcan, but it is responsive to other medical treatments like artificial ventilation and cardiovascular support. But that has to be done by medical personnel, so you have to call 911. Individuals who use xylazine may develop necrotic wounds away from the injection sites that may require advanced medical care. And again, a lot of people that are using substances are not paying attention to their physical health, right? You're not getting good checkups, blah, blah, blah. And they're not paying attention to these wounds. And also because of negative interaction with the healthcare system, they don't necessarily want to stop by the local ER and get those wounds looked at. So this is a great role for outreach workers, people in the community, other folks that come into contact with individuals who use drugs. Involving medical personnel and the comprehensive treatment plan in the case of these wounds is essential for full recovery because you're at risk for deep tissue infections like bone infections. They can get bloodborne infections. You can have heart infections from this. You can have amputations. So there's a variety of things that happen if these wounds continue to progress. And then lastly, we need more research to better understand xylazine. Our understanding of it is very much at the infancy. This was thought to be a drug too dangerous to humans, so no one did any research in it because humans weren't going to take it. Just being used in animals. Clearly, humans are now consuming xylazine at a frightening level, and having more research into understanding the behavior of the drug, as well as effects on humans, as well as the treatment, are really important next steps. All right, before I go there, just let me show you the references. And Dr. Kugler, I'll make sure you have this PowerPoint presentation to distribute. And I tried to put direct links wherever I could. Some of them, they're not on the internet, at least in a direct link I could find. Others are, and I was able to give you links to those. Let me show you one more slide. Be here. This is me, and that's my email address. So that'll be on the PowerPoint. If you have questions, something you want to ask me we didn't get time to, or something you might ask in the open chat, please feel free to email me at mark.fuller@carelon.com. All right, let me go back to questions and discussion. So, Dr. Kugler, shall I open my chat now too? Take
Feel
a look.
free. And I've been watching, so nothing else has come through. But if anyone would like to put any messages into the chat, feel free to. Will the PowerPoint be available? We will be able to send the PowerPoint out to everyone who attended today. So yes, we will be able to send that out, if that's okay with you, Dr. Fuller.
Yeah, absolutely. Some of the pictures are a little big, and so I'll send you, so it may not get through some emails. I'll send you one with all the pictures, and I'll send you one without the pictures, just to give you a smaller file that some people may need because it won't go through their systems. Oh, and thank you for the kind compliments.
Dr. Fuller, could you stop sharing? I'm also going to share my screen. Okay, if there are any questions at all for the Shatterproof team, feel free to reach out to us at any point in time. We'll give it still a few more moments for anyone to type anything into the chat. Glad that individuals seem to be find this informative, and especially if you have, within your practice, if you have not seen the xylazine or the wounds before, it can definitely be disturbing the first time that someone comes in exhibiting some of the symptomology, and it can also have a little bit of a different presentation since it is generally an adulterant first. So really appreciate everyone coming. Have a wonderful remainder of the week and a wonderful holiday season and New Year. It's great seeing everyone here today.
Happy holidays. Thank you very much, Dr. Kugler and Shatterproof. Really appreciate the chance to sit with folks and talk today.
Thank you.
And continues probably most of the Southeast United States and Northeast United States, and then the Great Lakes states in the next year or so are likely to have that. It's unclear how far west this may go, but from at least one of our listeners, it's already in Los Angeles. So it's likely to be spreading pretty fast. Co-occurring xylazine and opioid withdrawal can be managed. It's a question of obviously treating the opioid symptoms, but also looking for sedative withdrawal symptoms from the xylazine. Xylazine increases the risk of fatal overdoses, and it's not responsive to Narcan, but it is responsive to other medical treatments like artificial ventilation and cardiovascular support. But that has to be done by medical personnel, so you have to call 911. Individuals who use xylazine may develop necrotic wounds away from the injection sites that may require advanced medical care. And again, a lot of people that are using substances are not paying attention to their physical health, right? You're not getting good checkups, blah, blah, blah. And they're not paying attention to these wounds. And also because of negative interaction with the healthcare system, they don't necessarily want to stop by the local ER and get those wounds looked at. So this is a great role for outreach workers, people in the community, other folks that come into contact with individuals who use drugs. Involving medical personnel and the comprehensive treatment plan in the case of these wounds is essential for full recovery, because you're at risk for deep tissue infections like bone infections. They can get bloodborne infections. You can have heart infections from this. You can have amputations. So there's a variety of things that happen if these wounds continue to progress. And then lastly, we need more research to better understand xylazine. Our understanding of it is very much at the infancy. This was thought to be a drug too dangerous to humans, so no one did any research in it because humans weren't going to take it. Just being used in animals. Clearly, humans are now consuming xylazine at a frightening level, and having more research into understanding the behavior of the drug, as well as effects on humans, as well as the treatment, are really important next steps. All right, I'm gonna, before I go there, just let me show you the references. And Dr. Kugler, I'll make sure you have this PowerPoint presentation to distribute. And I tried to put direct links wherever I could. Some of them, they're not on the internet, at least in a direct link I could find. Others are, and I was able to give you links to those. Let me show you one more slide. Be here. This is me, and that's my email address. So that'll be on the PowerPoint. If you have questions, something you want to ask me we didn't get time to, or something you might ask in the open chat, please feel free to email me at mark.fuller@carelon.com. All right, let me go back to questions and discussion. So, Dr. Kugler, shall I open my chat now too? Take
Feel
a look.
free. And I've been watching, so nothing else has come through. But if anyone would like to put any messages into the chat, feel free to. Will the PowerPoint be available? We will be able to send the PowerPoint out to everyone who attended today. So yes, we will be able to send that out if that's okay with you, Dr. Fuller.
Yeah, absolutely. Some of the pictures are a little big, and so I'll send you, so it may not get through some emails. I'll send you one with all the pictures, and I'll send you one without the pictures, just to give you a smaller file that some people may need because it won't go through their systems. Oh, and thank you for the kind compliments.
Dr. Fuller, could you stop sharing? I'm also going to share my screen.